Welcome to The Explainer. Today, we're diving into a major scientific review from the journal World Psychiatry, all about adult ADHD. We're going to kick things off with part 1, which covers how it's diagnosed, how common it is, and what the science says about its causes. All right, let's jump right in with a really important number. For a long time, people thought ADHD was just a childhood thing, right? Well, we now know it continues into adulthood, and it affects an estimated 2.5% of adults all across the globe. For years, the whole idea of ADHD in adults was seriously debated. But now, there's a huge body of research that backs up its validity on 3 scientific fronts. First, there's descriptive validity, meaning we can clearly identify its symptoms. Then there's predictive validity, which has to do with its consistent life course and how it responds to treatment. And finally, concurrent validity, which is all the evidence we're getting from genetics and neurobiology. So to really build a complete picture here, we've structured our breakdown into 5 key sections. We'll start with why it's a legitimate medical condition, then move into symptoms, other co-occurring conditions, its real-world impact, and finally, we'll look at its biological roots. Okay, first things first. It's so important to establish that adult ADHD isn't some new trend. It's a well-defined medical condition, and it's backed by a long history of research that confirms its scientific legitimacy. So now that we've established its validity, let's get into the core of it all. What do the symptoms actually look like in adults? And what's the rigorous, multi-step process for getting a professional diagnosis? Now, this is where things get really interesting, because the way ADHD shows up can change a lot over a person's life. That classic hyperactivity you see in kids, the running and climbing, well, in adults, it often turns inward. It becomes this feeling of inner restlessness, like you just can't relax. And impulsivity, it can shift from, say, interrupting people in class to making huge life decisions on a whim, like quitting a job or impulsive spending. This slide really gets to the heart of a major debate in the field. See, beyond the official core symptoms, clinicians consistently see other major issues. Things like emotional dysregulation. We're talking intense irritability and mood swings. That affects up to 70% of adults with ADHD. Or executive dysfunction, major trouble with planning, prioritizing, and managing time. And yet, neither of these are officially part of the core diagnostic criteria. So how is it diagnosed then? Well, a proper assessment is a multi-step process. It's not just a simple checklist. The gold standard is a structured clinical interview that's then backed up with reports from people who know the person well, like a spouse or family member. Critically, you need a detailed history to confirm that symptoms were there before age 12, and you need to see that the impairment is pervasive, that it's affecting life at home, at work, and socially. This is an absolutely critical point to understand. Even with all our advances in brain scans and psychological testing, there is currently no single blood test, no brain scan, no computer task that can diagnose ADHD. The diagnosis is, and remains, a clinical one. It's based on a comprehensive evaluation of a person's symptoms and impairment across their entire lifespan. All right, let's move on to one of the biggest challenges for adults with ADHD, the incredibly high rate of what we call comorbid conditions. That is, other medical conditions that occur at the same time. And wow, this data is pretty stark. For adults with ADHD, having at least one other psychiatric condition is actually the rule, not the exception. The odds of also having bipolar disorder are nearly 9 times higher. For anxiety disorders, it's 5 times higher. And for substance use disorders, almost 5 times higher. It really shows how complex the picture can be. And the impact isn't just limited to mental health. The research shows a clear link to physical or somatic conditions too. The odds are significantly higher for things like sleep disorders, obesity, asthma, and even type 2 diabetes. There's also an elevated risk for cardiovascular disease. This really drives home the point that ADHD is a whole body condition. So that brings us to the next logical question. Who does adult ADHD affect, and what does the real, tangible, day-to-day impact actually look like, both for individuals and for society? Okay, this is a fascinating epidemiological shift. In childhood, boys get diagnosed about 3 times more often than girls. But by the time you get to adulthood, that ratio evens out to about 1 to 1. And a big reason for this seems to be that girls and women, who often have less disruptive, more inattentive symptoms, are just frequently missed or overlooked when they're younger, only to be identified much later in life. The economic burden is also pretty substantial. Studies show an excess cost per person every single year that ranges from over $1,000 to more than $4,000. that's actually comparable to other chronic physical conditions, and it's driven by things like lost productivity, using healthcare services more often, and costs related to accidents. This all leads us to the fundamental question of etiology. Where does ADHD even come from? So now we're going to look at what the science tells us about its biological underpinnings, from our genes all the way to our brains. When it comes to the origin of ADHD, the single most established factor, hands down, is genetics. Study after study, especially with twins and families, consistently finds that ADHD is one of the most heritable psychiatric conditions out there, with an estimated heritability of 70 to 80%. So what about on a neurobiological level? Well, research points to differences in both the brain's structure and its function. One of the leading theories involves something called the default mode network. That's a set of brain regions that are active when our mind is wandering. The idea is that in ADHD, this network can interfere when you're trying to focus on a task, leading to those attention lapses. But it's really important to say that the findings in adults are still pretty varied and not as consistent as what we see in kids. Now we're getting into a much newer and, frankly, more uncertain area of research that's asking a really fascinating question. Could the bacteria living in our gut, our microbiome, actually play a role in ADHD? Some of the first meta-analyses have found some interesting associations, like linking higher levels of certain microbes to hyperactivity and lower levels of others in people with ADHD. But, and this is a huge but, this field is brand new. The source material is very clear that the findings are often inconsistent from one study to the next. We need a lot more research to figure out if this link is real and what it could possibly mean. Okay, we have covered a ton of ground. So to wrap this all up, let's just crystallize the 4 most important take-home messages from this entire scientific review. So let's recap the big points. Number 1, adult ADHD is a valid chronic condition with symptoms that change and evolve over time. 2, diagnosis isn't simple. It takes a thorough clinical interview and a history of childhood symptoms, because there's no magic biomarker. 3, having other co-occurring conditions is the rule, not the exception. And finally, 4, its origins are strongly biological, with incredibly high heritability. And all of this leads us to a really critical question, both for patients and for the doctors who treat them. It also sets the stage perfectly for part 2 of our analysis, where we're going to explore all the evidence for the treatment and management of adult ADHD.